So our next topic is Dermatitis Herpetiformis. We are done with eczema and eczema herpeticus. Now our next topic is Dermatitis Herpetiformis. So as its name indicate, it is also a herpetic-like infection, herpes-like infection. So this is a dermatitis that result in a herpes-like infection in a patient. So the features of Dermatitis herpetiformis will be itchy and vesicular skin lesions in patient with a history of celiac disease. So Dermatitis herpetiformis, it occurs in patient with celiac disease, as its name indicate, it will be a rash, an itchy rash, because Dermatitis herpetiformis, herpes like itchy rash, that is vesicular skin lesions on extensor surfaces. For example, in the regions of elbow, knees, and buttocks. As you can see in this diagram, the vesicles in this diagrams are crusted. So in a patient with a history of celiac disease, because uh, there is formation of autoantibodies due to hypersensitivity reaction to gluten. These antibodies, these are mostly IgA. So these IgA antibodies, they deposit in the dermis and result in the formation of Dermatitis herpetiformis. So someone with a history of celiac disease present to you with an itchy and vesicular skin lesion on the extensor surfaces, then you will suspect Dermatitis herpetiformis. The diagnosis of Dermatitis herpetiformis is made on a skin biopsy. Skin biopsy will show a deposition of IgA in a granular pattern in the upper dermis. Short-term management of Dermatitis herpetiformis is Dapsone. Dapsone is a drug that prevent the chemotaxis or movement of neutrophils. And the long-term management of Dermatitis herpetiformis is gluten-free diet. A short summary of presentation and management of Dermatitis herpetiformis is that very itchy, burning blisters that are found on the extensor surfaces. In someone with a history of celiac disease, management is short term is Dapsone and long term is uh, lifelong gluten-free diet. The mechanism of action of Dapsone is that it inhibits the neutrophil migration and their function. So we are done with Dermatitis herpetiformis. Now the next type of dermatitis that we are going to discuss is contact dermatitis. Atopic dermatitis, Dermatitis herpetiformis, and now contact dermatitis. As its name indicate, this dermatitis is due to contact with some chemicals or some metals or anything, contact with anything that result in dermatitis will be known as contact dermatitis. There are two types of contact dermatitis. One is irritant contact dermatitis and the other is allergic contact dermatitis. Irritant contact dermatitis is due to a non-allergic reaction to weak acids or alkalis such as detergents. It is often seen on the hands and erythema is usual, but there is no crustings or there is no vesicles. So the first type of contact dermatitis, that is irritant contact dermatitis, it is due to irritation. Irritation due to chemicals such as acids or alkalis. Example of acid and alkalis, they include detergents. In irritant contact dermatitis, because it's a non-allergic reaction, so there will be no crusting and no vesicles, only erythema or redness due to irritation. While the second type of contact dermatitis, that is allergic contact dermatitis, it is an allergic reaction. Type 4, sorry, hypersensitivity reaction. Type 4 hypersensitivity reaction. In allergic contact dermatitis, because it is a type 4 hypersensitivity reaction, so it will present with crusting and oozing of fluid. What chemicals or what things can cause allergic contact dermatitis? Common allergens that can cause allergic contact dermatitis, they include nickel that is present in jewelry, watches, coins, and keys. So if someone after in contact with these jewelries, watches, coins, and keys, they develop a rash on the point of contact, then it will be allergic contact dermatitis. Chromates that are present in cements and leathers, they can also cause allergic contact dermatitis. Remember that cement is a frequent cause of contact dermatitis. The alkaline nature of cement may cause an irritant contact dermatitis, while the dichromates that are present in cement, they can cause allergic contact dermatitis. So cement can cause both type of contact dermatitis. The other causes of allergic contact dermatitis, the important cause that you need to remember is a nickel that is present in jewelry, watches, and coins. This is also known as a nickel dermatitis or nickel contact dermatitis as well. The treatment of contact dermatitis is topical steroids. First of all, you need to avoid the implicated allergens, and then uh, topical steroids may also be used. And to identify the allergens that had led to allergic contact dermatitis, we can do patch testing to identify the chemicals that a person is allergic to. So this was all about contact dermatitis. Contact dermatitis, as its name indicate, it the dermatitis that develop after in contact with certain agents. It can be irritant, it can be allergic contact dermatitis. Irritant contact dermatitis is due to irritations due to weak acids or alkalis. Allergic contact dermatitis is due to uh, type 4 hypersensitivity reaction. And remember that type 4 hypersensitivity reaction, it takes time to develop. So the person will develop rash after hours or even days after contact with the substance that can lead to allergic contact dermatitis or type 4 hypersensitivity reaction. Patch testing is done to identify the implicated allergens, and topical steroids can be used in the treatment of. Now we discussed atopic dermatitis or eczema. Now there is a criteria for the diagnosis of atopic dermatitis or eczema that is known as Williams diagnostic criteria. What is Williams diagnostic criteria? A child must have an itchy skin. So if a child present to you with an itchy skin plus three of these sign and symptoms, three or more of these sign and symptoms, that is onset of this itchiness is before 2 years. Second criteria is skin crease involvement such as elbow or behind the knees. Third point is history of generally dry skin. or a personal history of other atopy, or a history of atopy in first degree relative. And there is dermatitis on cheeks, forehead, and outer side of limbs if age is less than 4 years. So William diagnostic criteria is basically a diagnostic criteria for atopic dermatitis in children, that a child who has an itchy skin and the onset is before 4 years and there's skin crease involvement and there's a history of personal history of atopy or history of atopy in a first degree relative and a history of generally dry skin. So this was all about contact dermatitis, atopic dermatitis, dermatitis herpetiformis. I hope it's clear to everyone up till now.